Thank you for joining us today for our Survivorship special topic. My name is Julie Lanford, and I'm the Community Engagement Director at Cancer Services. We are a cancer support nonprofit located in Winston-Salem, North Carolina. And each month we post a special topic video with an expert in a variety of areas related to cancer survivorship and caregiving. And we post these videos on the Cancer Services website and YouTube channel, and the audio will also be released on our podcast, The Triad Cancer Connection. So today's special topic is spirituality and cancer, and our expert speaker today is Andrea Mitchell. Andrea is an oncology chaplain for Novant Health Cancer Institute in Winston-Salem. Welcome, Andrea. Thank you so much for joining us today.
Thank you, Julie. I'm really glad to be with you.
So let's start with the basics and have you help us understand what is the role of spiritual care.
So the role of spiritual care is to walk alongside really anybody who's just needing some support, needing someone to listen to them. Spiritual care has also been known as chaplaincy or chaplains, but it's been broadened. The language has been expanded so that it feels more accessible to folks. Because usually if you ask someone, hey, do you want a chaplain? That comes with a certain connotation. Often we're seen as like the Grim Reaper. But we're not the Grim Reaper. We're just there to provide extra support and make whatever you're going through a little more comfortable, or to ease your suffering. Things are already hard. They don't need to be harder. So some things that spiritual care offers is prayer, obviously. We're trained to minister to anybody from any faith tradition or no faith tradition, whatever your spirituality may be. We offer a non-judgmental presence, non-anxious presence. And if all you need is someone just to sit with you for a bit, we can do that too. We also do advanced directives, advanced care planning, and if you need help getting in contact with your faith community, we do that. There's spiritual care is broad and deep. And so if you have a question for us, if we don't know the answer, we'll find out who does it for you.
Very good. And does it take a referral or anything to see you? How does someone get in touch with a chaplain?
So if you're inpatient, you can ask your nurse or one of the staff members to reach out to a chaplain. And that looks like two different ways. One is they'll place a consult if it's like a non-emergent kind of thing that comes up in the medical records. So like our Epic electronic view, or they can page us here at Novant via Volt. Now, I work in the outpatient setting, so I get all kinds of ways of getting referrals. So whether through Epic, Volt, over in the cancer center, they use Teams a lot. So that's usually how I get my referrals, is those ways. And then in the main hospital, there's a spiritual care phone number that goes directly to my boss's phone in his office. We don't recommend calling that number usually, just because like if he's not in the office, then we don't know who's called. But that's some of the ways that you can ask for a chaplain.
Okay. And most hospital systems employ chaplains. Is that right?
Correct. So you should be able to ask any staff person, should be able to contact a chaplain, and they can get one for you.
Okay. So specifically thinking about like your position at an outpatient center, how is that different from chaplains who work inpatient?
So in the outpatient clinic, I am able to build a more long-term relationship with my patients, which I think is one of the biggest differences. And I am more integrated into an interdisciplinary team. So I work as part of support services here in our clinic, which includes nurse navigator, social worker, all that good stuff. Whereas in the hospital, while you are considered part of an interdisciplinary team, I feel like chaplains aren't as integrated inpatient because we're so busy. You know, you're getting paged left and right, or you have so many rounds that you need to do. And those patients typically are one-offs unless there's a special circumstance. Like if a patient's staying 3 months, you know, like you're getting to build that relationship. But if they're just there for surgery overnight, then they're gone the next day. So it's literally that intimate stranger kind of thing is what we call it. So that I would say that's the main difference is I get to build a long-term relationship over time and see my patients, whatever stage they're um, and their families in that regard.
Gotcha. And you also do some, like you partner with, like we have had you come speak for survivor programs. You partner with assisting with support groups. So kind of just a good person to have on the team.
Yeah, I do support groups, help y'all, partner with Choices and Champions, which is our advanced directive people here, helping to get that going. And, if you need to talk about end of life stuff, if you need to talk about other life stuff, that's what we're here for.
Yeah, I feel like that's especially helpful if a patient or a caregiver is kind of more thinking ahead or wanting to make sure their plans are in place, but maybe their loved ones aren't as
Yeah.
comfortable with the conversation, that you are a person they could think through things with, without having, and maybe even can help them have the conversation with their loved ones in a way that's not as scary.
Yes. So sometimes patients or their loved ones will come to my office, um, and they'll want to talk out how they need to talk to their loved one. Like they'll say, like for instance, I have one patient's wife who comes and sits with me, and she'll say things like, well, he's just so mean to me, because he's going through treatments. And me helping to explain, like, well, he's probably tired and aggravated with treatments. You're not the only spouse that I've heard say, like, their person kind of gets a little snippy with them. And have you tried talking to him about that? Because a lot of times as caregivers, they don't want to put the burden back on the patient. So they're
Yeah.
able to come talk to me and let me kind of hold that space with them and let them have a breath of fresh air. Where at other times, if they talk to someone else, they might feel like they're burdening them or like they're whining.
Mm-hmm.
But with me, it's not going to be like that.
Gotcha.
Mhm.
So you've been doing this work for 5 years, in your previous job and your current job as a chaplain. What have you noticed that people need most in their spiritual care?
Oh gosh. So I was thinking about that question. I'd say there's a few things. I would say support is a really big one. I find that a lot of patients do better when they have a good support system or a good support person, like someone who's going to be their cheerleader, someone who checks in on them. And I also feel like something people need is hope. Like hope is such a important thing for folks. So whether that's hope about their treatment, whether that's hope about getting their pain under control or their appetite back, and helping people to be able to sustain that hope, whatever it looks like.
Gotcha. Um, and what advice do you have for people in terms of, so, speaking of hope, finding hope, tending to their spirit during and after treatment? What have you seen is helpful, for that?
So again, re-engaging with their faith community is important for a lot of people. I know patients who, while they're going through treatment, they're worried about, catching things, which, of course that makes sense. They don't want to go to church and risk catching COVID or the flu. And a lot of them really miss their faith community. So one of the things is getting re-engaged with their faith community. Um, some people are worried about losing connection with the cancer center, and the people they've met here and engaged with for, months at a time. And when they go into survivorship. So I encourage volunteering or finding ways to give back or, joining support groups through cancer wellness, and cancer services. So I would say continuing to reintegrate back in, knowing that things aren't necessarily going to be normal again, or you won't be who you were before again, but that doesn't mean that you're not a whole person. So that's some of the things I would say hanging on to for hope is that, I don't look the way that I did before on the inside or the outside, but I can embrace this new person that I've become through this and
Yeah.
not being harsh on yourself, not judging yourself, but taking that as it is and learning to love it for what it is.
So speaking of kind of going to their spiritual community for support, I know I've heard for some people that they've maybe faced some challenges getting support from the spiritual community that they had, always been a part of, and then they were diagnosed with cancer and things just seemed different for them, or they didn't
Yeah.
maybe get the support that they were hoping for. How can they help their spiritual community know best how to support them during that time?
So if I can, I'll flip that question around a little bit about how their communities can support them. Um, some things that I've heard from patients that have not been helpful when they're going through treatments is, one, they don't want people coming up and asking them how they're doing every time they see them. Like they don't want to constantly be reminded about the fact that they're going through treatment, or, wanting to bring stuff up when everybody's passing the piece, because in that split second, like, you could dredge up all this stuff and it's not enough time to talk it out. So I'd say that's one. Understanding that if people don't want to hug, like it's not because they don't like you, but they're trying to protect themselves. I would say those are two of the biggest things, not constantly saying, "How are you?" or asking questions like that because you don't know what else to say to them, but
Yeah.
treating them like you did before they were diagnosed. Um, and to flip that back around to the individual who would have cancer, reminding people that, like, thank you for asking, but I don't really want to talk about that today. Like, claiming their agency is really important. Maintaining their person is really important, and learning how to use their voice or talking to their support person to kind of be their voice is something I really encourage.
Yeah. And we also have similar two different handouts that we have for people about how to talk with others about their cancer, and
Mhm.
then how to support someone through cancer. Is very similar to what you said, which
Yeah.
is, kind of finding the right way to approach people so that it's supportive for them. So this has been super helpful. We really appreciate you sharing all this great information. As we kind of close out this topic, I did want to ask if you would share one piece of advice for our viewers as sort of a take-home point.
My advice is to be gentle with yourself. Just be gentle with yourself because your best looks different every day. If you got out of bed, that's something to celebrate. If you're able to keep down some food, no matter how small, that's something to celebrate. And honestly, miracles look different every day. And I feel like we tend to ignore even the little ones. So celebrating all of that, celebrating each day, I think would be my biggest piece of advice.
Awesome.
Yeah.
Thanks so much for your sharing your expertise. If somebody were to want to get in touch with you, and I'm assuming even if they're treated at another treatment center, you may be able to help connect them to someone at
Mhm.
their center. What's the best way to reach you?
So you can call my office number. Can I say that? Like,
Yep.
okay,
Yep.
it's
And I'll put it in the show notes for anybody.
it's 336-718-8588 is my office number. If I miss you, leave me a message because I'm not always in my office. I'm out visiting with folks. Or you can shoot me an email at amsimons, which was my maiden name, SIMMONDS at NovantHealth.org.
Awesome. And I'll make sure that's listed in our show notes so that if you do have questions or need help connecting, you can reach out to Andrea. So that wraps up our topic for today. And just as a reminder, we have all of our expert interviews posted on our YouTube channel as well as on our podcast, the Triad Cancer Connection. And then we also have a webpage on our website that lists all the topics that you can find the recording. So thank you so much for joining us today for our special topic. Stay updated on our survivor programs by checking the Cancer Services website. Make sure you're on our email newsletter, our print newsletter mailing list, and our social media channels. So have a great day, and we look forward to seeing you soon. Thanks so much.